Hi, my name is Dr. Patrick Garrett. I have a concierge practice here in Newton, Kansas. Our goal is to reverse acute and chronic conditions naturally. We do this through lifestyle management and nutritional remedies and food therapy. Now, one of the things that we want to talk about today is how we treat type 2 diabetes. Type 2 diabetes at this point is 1 in 2 people that are either pre-diabetic or are actually type 2 diabetic. Now, it's interesting to know that diabetes type 2 wasn't identified or, say, documented until 1959. By the 1980s, we were almost at epidemic status. And of course, by 2011, it's 1 in 2 people. Now, there was an interesting study that even said that children born after the year 2000, that 1 in 3 would be type 2 diabetic in their lifetime. Now, if they were non-white, the rate was 1 in 2 to become type 2 diabetic in their lifetime. Which basically means if you eat, drink, and breathe and rub stuff on your skin like an American, you're going to get diabetes. There's something about living in the U.S. as opposed to all the other countries in the world that equals diabetes. Isn't that strange? Imagine you could live in another country and not be at such a risk of type 2 diabetes. And that's because it's self-induced. Many people don't know that diabetes type 2 is preventable, 100% preventable, and reversible. And one thing that we like to do in our clinic, and we have done, is to reverse type 2 diabetes in as short as 10 weeks. There's been studies that have shown people do it in less than 2 months. And it really depends on what is your status within type 2 diabetes, what's your blood sugar levels, how out of control is your diabetes, what's your diet like, what's your lifestyle like. The reality is type 2 diabetes is a foot and fork disease. And unless we address those two things, you will never be non-diabetic. Many of the medications that are used to chronically manage diabetes for the rest of your life also deplete vital nutrition like B12, coenzyme Q10, the very things that prevent heart attacks and oxidative damage in the body. The things that make you feel good and want to get up and want to exercise are the very nutrients that are depleted by taking that medication for the rest of your life. Now, I don't tell people to take medication, and I certainly don't tell people to get off their medication. For people that want to make lifestyle changes, that want to do what it takes to just not be diabetic, I can help them. We do this through very simple, yet aggressive, dietary changes, lifestyle changes. And one of the things that we offer now is to actually do a lot of hand-holding. We take you shopping. We'll actually look through your pantry. We'll help you make better food decisions. And there's even some nutrition that would help reverse or attenuate some of the damage that's already been caused. Because most patients, by the time they're diagnosed type 2 diabetic, they've had it for years. The Journal of Internal Medicine has actually came out and said there's 5 parameters, and now there's 6, to basically say that if you have any of these, you're pre-diabetic. Which means within 3 to 5 years, you're going to be diabetic, just like the vast majority of the population. 80% of people who are overweight and obese develop type 2 diabetes. It's not a surprise what causes it. It's a surprise that we don't do something about it, which we can, if you want. The other thing that's startling is that it's very expensive to not only be overweight, which is about $4,500 per person, but to be diabetic, it costs about 11 to 12,000 a year just to be diabetic. You have to give insulin shots. You have to take medications. You spend more on food, actually, and that's actually a myth that eating healthier is more expensive. You just eat a lot less and more nutritional, more nutrient-dense, low-calorie foods. So how do we do this? Well, basically, we have you fill out an evaluation, look at what are you eating, what are you doing. There's actually chemicals that can even make you fatter. Things like diet soda, aspartame, sweet and low, those kind of chemicals, they don't add more calories because there's 0 calories, but they actually will trick the brain and the liver and the gut, which stimulates you to actually be hungrier. So you eat more. And we want to address those things. Much of what we talk about will not be addressed in your standard, typical, diabetic education talks. Now, what we do isn't radical either. It's based on very basic human anatomy and physiology, basic biochemistry, and basic common sense. And unfortunately, you just won't hear that in most places. So, when we take a diabetic patient, we got to see what's going on, what's leading them to diabetes, and then we can start making changes in their lifestyle to help them lead back to non-diabetes. And then we make greater changes to ensure that they aren't close to pre-diabetes anymore. Now, if this is something that you and your family would appreciate, feel free to give us a call. And again, this is Dr. Patrick Garrett, and I'm on your side.